Hi everyone, welcome to our live office hours Q&A. Our special guest this evening is Musely Chief Science Officer and board certified dermatologist Dr. Brandon Kirsch. Dr. Kirsch has a medical degree from Brown University and completed his dermatology training at University of North Carolina. Has his own dermatology practice in Naples, Florida. I'm Chloe. I'm on the marketing team here at Musely. I actually have a couple questions to get us started. So my first question for you is, how long does the anti-aging night cream typically take to start working?
Yeah, that's a great question. There's a lot of variability, just like every type of medicine. Some people will see results much sooner than other people. All the clinical trials of tretinoin were 12 weeks in duration, so you should expect by week 12 or 3 months in that you will see results.
Great. So for someone like me, I'm 25. What age would you say people can start using tretinoin as an anti-aging treatment?
I started it as soon as I heard about it when I was a resident, so not that far off of your age. And I think it works really well as a preventative treatment as much as it does to treat already existing fine lines and wrinkles. A lot of people start tretinoin even in their preteens because it's a great medication for acne. So there's really not a time that's too soon to start tretinoin topically.
Great. That's great to know. So how do you recommend applying tretinoin?
This is an amazing question, okay? And you'll notice that really medicine is an art, not a science. So if you ask 10 dermatologists, you might get 10 different variations of the same answer, okay? But the first thing to recognize is that tretinoin can cause irritation to your skin. It is intentionally, essentially a chemical or peel, a micro exfoliant. And depending on your sensitivity, you're going to get too much peeling or just the right amount. So we like to start everyone, we say go low and start slow. So what I recommend just out of the box for everyone is to start only every other night at the most, if you're treatment naive, which means you've never used tretinoin before. And I love this moisturizer sandwich technique. I tell all my patients, and that means you put a moisture on, a plain fragrance-free moisturizer on your face. You coat after you wash, you coat your face with moisturizer. Then you apply your tretinoin. The way I always recommend to applying tretinoin also is you put a pea-sized amount on your fingertip, and then you dab it all around your face. You know, when I was younger, I was guilty of this as well, but I put a bunch on my fingertip, then I'd stick it here, and then I'd start rubbing it. Well, most of it's going to go in that one spot.
Right.
So you want to put a pea-sized amount on your fingertip and then dab it all around, so you've got little dots all around your face, and then rub them in. So you spread it around a nice, even, thin layer, and then you put the top layer of the sandwich, and you moisturize it, and you lock in that moisture. You can't over-moisturize your skin, basically, and because retinoids can be drying and irritating, it's really important to do that. You know, the number one complaint that we get is irritation, and if people get too much irritation early on, then they're going to stop. So it really makes a lot of sense to start slow.
So how would you recommend that patients can avoid peeling when they're using tretinoin?
Start slow approach and the moisturizer sandwich every other night, and then sometimes you're going to have to titrate it. So for some people, they'll start doing that. They're not going to notice anything. They have like zero irritation. Well, maybe they want to push it a little bit more. They can go to every night. And then you should still always do the moisturizer sandwich. Other people, even with that every other night, are going to notice that their skin's getting a little red. It's peeling a little bit. So in that case, they're going to want to reduce the frequency of the application. And for those people, I say 1 to 2 times a week even. And then you can start to titrate back. And then the final tip that I'll give, because even for some people, depending on the concentration that they're prescribed initially or how sensitive they are, even with that 1 or 2 times a week treatment protocol, it might be too much. And that's probably because your tretinoin prescription is too strong for you. But here's the beautiful thing. If you have too strong of a prescription of tretinoin, you can always dilute it to a weaker strength. So, you know, the Musely prescriptions go from 0.025 to 0.05 to 0.1. So 0.1 is the strongest. Well, if you dilute the 0.1, 1-to-1 with moisturizer, you're getting that 0.05.
Right.
And if you dilute it, you know, 4-to-1, you're getting the 0.025.
Yeah, that's a great tip. And I think one of the really special things about Musely too is if you are experiencing irritation, it's really easy to access your dermatologist. You can reach out right on our app. So you really get fast answers if you're having an issue.
Yeah, I mean, I really pride myself on how quickly I can respond. My average response time is about 4 hours, which is really good considering I do have to sleep.
Yeah. So here's a similar question. So if someone started with 0.025 and had no side effects, can they or should they bump up to 0.5?
Yeah, the 0.05. Yeah, exactly. I mean, there's two different approaches here. I mean, if you're really treatment naive and you have sensitive skin, and most patients kind of have a general idea where they are in that spectrum of sensitivity, I say it's a good idea to start with the 0.025. You use it for a couple months. You say, hey, there's no problem, increase it. Because it is a bit of a pain when you get that redness and that itching and that tenderness. And so if it can be avoided, that's good. So once you've established that baseline, it's a great idea. I mean, my own view is you kind of push it till you get that irritation and then you pull back. And that way you're kind of maximizing the amount of treatment that your skin can withstand. And there is a correlation between the strength of the prescription tretinoin that you use and the overall results. We've seen that in the studies.
Let's see. Is it safe to use vitamin C during the day and the anti-aging night cream at night?
Yeah. So this is a question that comes up all the time. When I start someone on a new prescription, I say drop everything that you're doing. Just use a gentle cleanser, a plain fragrance-free moisturizer, and an SPF sunscreen with zinc oxide or titanium dioxide, which are mineral sunscreens. They have the broadest spectrum of protection, and they're least likely to cause skin irritation. So you start there, you titrate up to where your skin is comfortable with the tretinoin, whether it's every other night, whatever the concentration is that you're at, and then you can start to layer back some of your other products. And I think vitamin C is a great product, and those two things work really well together. But my recommendation is to pare down when you start with the tretinoin, and then you start to layer things back on top.
Okay, that's great to know. Sometimes you just got to start with the basics.
Exactly, and then that way you can really you can figure out exactly where that maximum tolerability for you is with the retinoid.
Yeah, great. So can the anti-aging night cream be used in morning and at night?
That's not a good idea. I get it, because a lot of the muesli products, like the spot creams, you can use twice a day. And this is part of the reason that I like to have people often use both prescriptions separately. Muesli has a spot cream that already has tretinoin in it. But if you do that, you can only use it at night. But if you get the spot cream without the tretinoin, and then you get the tretinoin separately, you can start to play around with things, and you have a little bit more finesse. So the spot cream without the tretinoin, you can use twice a day, but the tretinoin's only at night. If you use it twice a day, two problems are going to happen. One, you're going to get skin irritation without any really additional marginal benefit. And two, actually, tretinoin is called photolabile. So that means that it breaks down when exposed to heat and light. So wearing it in the day, you just kind of be wasting your money, even if you were able to tolerate it.
Okay. Wow. Let's see. We're getting some more questions in. Looks like we're pivoting to some hair growth questions.
Okay.
So can men and women take the hair pill? And are there different formulas for men and women?
Yes. Okay. Men and women can take the hair pill. Now, not only do I prescribe the hair pill and the hair solution, but I used it. And I'm always playing around. And so some days my hair's a little better than other days. I think it's pretty good. You should have seen me before, because I was really bald. It was kind of embarrassing. And I didn't really think about doing it until my wife prompted me, which is interesting. And so for all the women out there, your husbands might not do this on their own, but if you think they would benefit and like it, and I certainly did, because I'm much happier when I'm in front of the camera now, or when I get a photo. You can, encourage them and show them that this is something that works. And if you go on the Kirsch Instagram, you can see some of how bald I was before, because there's some before and afters. So there are 3 formulations of the hair pill. 2 out of the 3 are good for men, and 3 out of the 3 are good for women. Basically, the first hair pill just has minoxidil. So anyone can use that. You can use it topically and as a pill. So you can have kind of an inside-outside approach, and Musely has the topical and the hair solution, and then it has the pill with just the plain minoxidil. All the hair pills do have additional supplements that benefit hair growth, and they're all the same. They're just some vitamin supplements like biotin that are included. But the medically active ingredient in the first one is just minoxidil. Then the second formulation is minoxidil and spironolactone. Now, spironolactone has sort of a broad anti-androgen effect, so we don't recommend that for men. It's good for women, especially women of childbearing potential, because it doesn't have a long-lasting effect. So if you end up that you're planning to get pregnant, you can just stop it, and then you can go ahead and try and get pregnant. Or if you happen to get pregnant while you're on it, you can stop it right away, and it's not going to have like a significant impact on your pregnancy. The third one that we offer is a combination of minoxidil and dutasteride. Dutasteride also blocks a certain type of testosterone. It's a very powerful medicine. It lasts a long time. We don't prescribe that to women who are capable of having children even if they don't intend to, because if they do take it and they end up getting pregnant, it can potentially cause problems that we definitely want to avoid. But that medicine is very good for men as well.
So what happens if someone stops using the hair pill or the hair solution?
Yeah, sadly, I've experimented this many times myself. I already knew the answer, so it wasn't really something that I needed to prove. But hair loss, like so many other medical conditions, is a chronic problem. So there's no cure for it. You're not going to stop your hair loss just because you take this pill. You'll temporarily arrest it, and you can encourage new hair growth, and that does happen, and it's wonderful. But when you stop treating your hair, it will go back to your normal baseline. You won't lose more hair than you would have normally, but you will return to your baseline. And one thing to keep in mind, I always have to kind of explain this to my patients because they worry about it or they read things online. So you're not going to end up with less hair than you would have already, but over time, everyone is losing hair. And so if you take this pill for 5 years and you have like great hair growth and you're doing really well and then you stop, you're not going to probably go back to where you were 5 years ago, because if you hadn't been taking the pill, you would have been losing hair. So you're going to go to exactly where you would have been if you had never taken the pill.
Interesting. Yeah, upkeep's important.
Yeah, I mean, that's the truth. It's entropy. It doesn't matter what it is. If you're trying to maintain your car, your house, your pool, your skin, your hair, your overall health, whether you want to stay in shape, you go to the gym. If you stop going to the gym, same deal.
Right. No, absolutely. Someone's asking, which is better, the hair solution or the hair pill? Or do patients need both?
Yeah, I mean, they're both excellent products that work really well. I think a good starting place is always the hair solution because it's a topical, it's the lowest sort of risk profile. It depends on where your hair loss is and how aggressive you want to be. Anything with hair growth, it's really about layering treatment. So you're always going to get like an incremental marginal benefit by adding things. So if someone is really distressed about their hair loss or has significant hair loss, they could start with both. If they're just sort of preventative or want to regrow a little bit, they could start just with the topical. Some people will start with the oral because they don't want to do a topical. A topical has some downsides because, you know, maybe it changes sort of the texture or appearance of your hair. I don't really notice that personally, but some people might feel like they don't want to have that solution in their hair because they have other products that they like to use. But the hair pill is very easy because you can just take a pill in the morning and it doesn't affect anything. You don't have to worry about when you wash your hair or how you style it.
Right. Great. How long does it typically take for hair treatments to start working?
Yeah, this is such a good question. It's a little bit variable. I'd say after 3 or 4 months, you're going to see some great results. Some people are coming into the office or signing up on Musely and they're really distressed because all of a sudden they're losing hair at a very rapid pace. And if you're in that category, these medicines can actually kind of arrest that process and you might see a result like really quickly. You know, some people I'll treat and they'll say, man, I was losing all this hair so quickly, and then in 2 weeks it really tapered down fast, and then the hair growth will start after that, but they're already delighted because they're not seeing these clumps of hair going down the drain. But all things equal, to really promote the hair growth process and to see some results, you're looking at, you know, a 3 to 4 month process probably.
Someone is asking, does the hair pill or solution work for growing facial hair?
That's a really good question. Not a lot of people use it for that. I would suspect that the answer is yes. I've not actually tried it myself or prescribed it for facial hair. I will tell you that one of the potential side effects of taking the hair pill is growth in unintended areas off the scalp. The Musely prescription, so this is really a great thing about Musely, is the commercially available, if you go to Walgreens and get a prescription for just minoxidil plain, it comes in a 2.5 milligram tablet. Musely's prescribing at 1. And what people have found is that the lower dose is safer and it's less likely to stimulate hair in unintended areas. So especially for women, they don't want to have facial hair, obviously. I'm not sure if this is a question from a male who wants to have more facial hair. I did notice when I was experimenting, and I went on a very high dose of minoxidil because, like I said, I'll try it on myself before I recommend it to any patients. But I was over 5 milligrams. I felt like the hair in my beard area and my legs was a little bit heavier. Certainly some women, if they are 2.5 and above, will start to notice some hair growth in unintended areas. It is manageable. If they're really happy with the hair on the head, they'll continue. But with Musely at the 1 milligram, we don't see that a lot. And then the important thing to recognize also is if you were really unhappy and you did have hair in some unintended place, then you could stop it and it will go away.
That's great to know. Let's see. Will the hair pill work for postpartum hair loss?
Yeah, absolutely. It's going to work for any kind of hair loss. So that's the wonderful thing. If you have a very specific type of hair loss, then I wouldn't count postpartum, because postpartum, it is a specific type, but it doesn't have like an underlying cause other than you were pregnant, you gave birth, and now you've lost some hair. You know, some hair loss is from like a nutritional deficiency. Some hair loss might be from an abnormal thyroid. There are underlying medical conditions that can cause hair loss. And if you address the underlying condition specifically, obviously that's going to really improve your hair growth. But that aside, all causes of hair loss will respond to the hair solution and hair pill. So even if you had a thyroid problem that was causing hair loss, taking these medicines would help. And they're often, generally, they're almost always prescribed in that situation.
Right.
So these cover all your bases. But if you do have an underlying problem, you do need to address that. But postpartum, there's really nothing to address. You know, you will eventually get your hair back, which is a great thing about that. And now you've got a wonderful, beautiful baby, so that's pretty good.
Of course. Let's see. We have a question. Why don't the hair treatments include finasteride?
Yeah, well, that's a great question. I think originally they did include finasteride, but now we scaled. It's like we got the iPhone 7 and the iPhone 10, now the 14. This is the iPhone 15. Right. Dutasteride is a much more effective medicine than finasteride for stimulating hair growth. And it's very innovative for Musely. They're one of the first places where that's offered. I'm sure there'll be a lot of copycats later, but all the research has shown that dutasteride is much more potent. And so it works way better, and that's why we've phased out the finasteride.
Can the hair solution or hair pill make someone's hair fall out initially?
This does happen. It's kind of like purging when you use a medicine for acne, like even a retinoid like Tretinoin, so this ties in with both. If you have a propensity, I'll just touch on this because it's important, tangentially. If you have a propensity to acne and you start an acne medicine like a retinoid, like Tretinoin, then it can stimulate pushing out all the acne that's formed under your skin. So that was going to come out anyway, and it was going to come out kind of sequentially, one pimple here, one pimple there. Once you start this medicine, it's basically stimulating that process to all occur at once, and you have something called purging, which people are generally fairly familiar with. It's sort of a similar process with the hair treatments. Your hair exists in several different stages of growth. One is active growth, one is resting, and one is shedding. And it goes sequentially through those stages. So you start in growth, and then you go to and then about 80% of your hair is in that growth phase at any given time. 20% is in the resting, and then from resting, it starts to shed, okay? So what you want to do and what this medicine does is it's pushing more of your hair into the growth phase. So let's say because your hair growth isn't as good, your hair isn't growing as long. So this will allow your hair to grow longer as well, because it's stimulating your hair to go to the growth phase and stay longer in the growth phase. But the hairs that are already basically dead, like if you imagine trees in the forest that were already dead, now when you start to fertilize the soil and you start to use the hair solution and hair pill, you're pushing the dead trees out and you're getting new growth. So temporarily, you might see some additional hair loss, which is actually a good thing, because now those hairs, you know that they're getting pushed out earlier because new healthy hairs are coming up underneath them. And you were going to lose them anyway, and they weren't going to grow anymore.
Right.
And now you're going to have more hairs in the growth phase that are going to be in that longer. And that's why you get longer hair, and that's why you get more density.
Great. Yeah, I had no idea it could help you grow your hair longer too.
Yeah.
That's very cool. I know we touched on some other types of hair loss a bit, but someone asked, does this work for telogen effluvium?
Telogen effluvium. Basically, postpartum hair loss is a form of telogen effluvium. What telogen effluvium is stress-related hair loss. So when you hear like these old stories or anecdotes about like, oh, my hair is going to fall out, like I'm so stressed or whatever, that's true. That's a cliche because it actually happens. So when your body goes through a lot of stress, it shuts down its hair growth. It kind of reprioritizes. It's like a triage. You know, if you get really sick, if you get hospitalized, if you have something significant psychologically happen in your life, your body doesn't want to spend energy and time growing hair. And as a result, it's going to widely migrate from the growth phase to the resting phase. So instead of like that 80-20 split, your body's going to say, hey, we're not going to waste energy. We're now 60-40. So 20% of your hair is going to come out. And that happens in postpartum. That's very stressful to the body to have a baby. And so that is the exact same basically condition, just sort of a different name. And yes, it is helpful because again, this is pushing your hair, stimulating you to go into the growth phase faster, move out of the resting phase, and it will expedite the process. So telogen effluvium, the good news is not permanent. If you have telogen effluvium, If you have stress, once it resolves, your hair will come back. That process can take a year or maybe even longer. If you take this medicine, it's going to rapidly decrease the amount of time that you're going to have that issue, and you'll grow your hair a lot faster.
Wow. Someone is asking, will our treatments grow back baby hairs?
Baby hairs are called vellus hairs. They're the little blonde, fine hairs.
Mm-hmm.
So especially if you're looking at this and you're thinking like, will my husband benefit or is it too late for him? Look at his scalp or look in your own scalp if you're doing it for you, and look to see if you can find those little fine baby hairs. Because if you have those fine baby hairs, we can stimulate them to grow back into the nice, long, black or brown or red hairs that you want, okay? If you don't have those hairs, if the hair follicle is totally closed off, it scars, that's the end point for hair loss. So if you've not had hair growth for a long period of time, eventually the hair follicle closes off and you don't have them. You'll see more of those baby hairs because they'll be more pronounced, but they were already there, and then they'll start to get a little bit, you know, they're like babies. They grow up, they become like toddlers, and then they become little kids, and then they become adults.
Yeah.
So, but if you have those babies, then you got something that you can work with.
Great, there's hope. Is there a reason it seems like someone might lose more hair when washing than brushing?
Yeah, I don't have a good explanation for that, about why that would happen. There's not really a reason. Anytime that you're kind of pulling or tugging on your hairs, it kind of depends on the individual and the circumstances. Then the hairs that, again, are in the resting and moving into the shedding phase are going to be pushed into shedding. People do see that a lot, though. You know, that's the thing that really traumatizes women, especially, is when they like washing their hair and kind of scrubbing it, and then all of a sudden in their fingers they've got all this hair. I mean, that hair is already kind of loose and coming out like a loose tooth. So I think maybe part of the explanation, if I was just kind of speculating, would be you're doing that in the shower and then you're brushing hair, so a lot of the hair's already come off. But there's not like a reason why washing hair that I can think of would make your hair come out more than brushing it.
So this one is a pretty broad question, but good to address. Does muesli really work?
Oh yeah, muesli definitely works. That's why I love this company. That's why I joined it. That's why I want to be a part of it. That's why I went into medicine, to help people and make a difference. These are all proven prescription strength medicines. They have a long history of clinical study, working in clinic, anecdotal research, every type of experience that you could have with a medicine to show that it works. These medicines have had. We have a kind of a rule at Musely. I'm the chief science officer. It's the 80-80 rule. That's our rule of thumb, which is that we expect when we bring a product to market that it will help 80% of the people and give them at least 80% efficacy. I mean, that's our rule of thumb, and there's always variation. So the fact of the matter is, when Musely assesses a treatment that it's going to bring to market, and that's why we've been successful too, it's because we believe in it, we know it works, it has a lot of science backing it, and we've seen it work in our own clinics. And we're all dermatologists that are involved with this company and making the medical decisions about what product to bring to market.
I see all the time on our social media people saying like, there's no way this is real, looking at our before and after pictures. And we actually have a patient forum with over 170,000 Musely patients posting themselves their reviews, their images, and connecting with each other. So if you are looking for more proof, we have it. You can go to the community page on our website and check out over 170,000 patients posting.
Yeah, I mean, this is the real deal. There's so much fake, stuff out there, and I understand why people are really skeptical. I mean, over-the-counter products, especially, they promise the world. They really don't deliver. These are FDA-approved prescription drugs, and they've been curated by a team of dermatologists that operate at a very high level. For the price, I don't think there's anything even comparable, especially because even over-the-counter products at Walgreens, you could spend $30 or $40 for an anti-aging moisturizer. I think, you're going to be clocking in at a pretty similar price, but for a prescription product that is definitely going to give you a result. I mean, the result is also kind of, you can see with the side effects, like with Tretinoin, that if you use it too much, you're going to get side effects. That means it's doing something. It is working. We have to harness it and make sure that it works in a positive way for you, but this is a real product that can make a difference.
Absolutely. So speaking of Tretinoin, we can pivot back to anti-aging here. And you touched on this a little bit already, but will the anti-aging cream treat acne or acne scars?
It will absolutely treat acne. Tretinoin is a foundational treatment for acne. It's really the first line that most dermatologists will use regardless. So it certainly will help with acne. The important thing to keep in mind is that initially, like I mentioned earlier, you can get a little bit of a purge, But almost everybody who needs an acne treatment is going to start on tretinoin if they go and see a dermatologist, whether in the real world or on Musely. Usually we don't target acne specifically. We're targeting hyperpigmentation, but a lot of hyperpigmentation from people is called post-inflammatory hyperpigmentation. And the underlying cause is that they're getting acne, and then the acne, as it resolves, leaves those dark spots. So if you can treat the dark spots and simultaneously treat the underlying problem, then that's really a double win. In terms of acne scars, look, this is a tough problem, and there isn't a really good solution. If you're going to go and try and find a solution to treat this, then tretinoin is your best bet. Because if you treat the acne, you're not going to get more scars, and that's really important.
Yeah, absolutely. Let's see. Does the anti-aging night cream help with frown lines?
Frown lines are a little bit deep. So the anti-aging, we have to have kind of realistic expectations. I wish that would be amazing, but I usually try to smile. That's the best thing. Maybe this will make you smile because you get rid of the finer lines and wrinkles. You get more of an even skin complexion. You get a brighter complexion. You get kind of like a glow to your skin. It will help with the pores.
What products or ingredients can and cannot be used with the anti-aging night cream?
Yeah, so like I mentioned right off the bat, the first thing to do when you start this is to pare everything down to basically zero. Gentle cleanser, plain, fragrance-free moisturizer, mineral sunscreen, zinc oxide, titanium dioxide. If you have other products that you like already, once you get to steady state, which means that you've got into like everyday use, basically, every night use, and you're tolerating well, you can one at a time start to add some of your other products. One important thing to know is, and this is kind of a case-by-case basis, but some products will interact directly with the tretinoin, so you wouldn't want to combine them. Things that mostly have acid in the name. Now, I get this question a lot about hyaluronic acid. That's different. That's like an emollient. It's a moisturizer, but things like glycolic acid, the alpha and beta hydroxy acid, salicylic acid, you wouldn't want to use them together. Benzoyl peroxide. They just don't work well as medicines, but you can use them. You just have to separate out. So you might do some in the morning and then some at night once you're able to tolerate them.
Okay, great. And again, I just want to touch on Musely is special because if you do have a quick question like this, it's so easy to reach your Musely dermatologist through our app. And so you kind of always have access if you have if you wanted to start incorporate something new into your skincare routine and you're using one of our products, it's really easy to get answers fast.
You can do some of these things and take a day off, take a break from the tretinoin, and then do it. So maybe Saturday and Sunday is your exfoliation day. But the whole tretinoin is in itself doing a micro exfoliation every day. So you just don't want to do things that are going to increase your risk of irritation, because then you won't be able to use the product as much and then you won't get the full benefit.
Right. Can tretinoin be used by patients who also get Botox regularly?
Oh yeah, absolutely. I mean, those things go hand in hand.
Yeah.
If you're getting Botox regularly, then it should be against the law not to use tretinoin, because you're kind of you're spending all this money on Botox and then you don't have a great skincare regimen. When I'm in my office, if someone comes in and they're getting Botox, then I already know they're really interested in skincare, having their skin look their best. Those two things go hand in hand.
Yeah, you got to cover all your bases.
Yeah.
How can new patients determine which percentage of tretinoin is right for them?
Yeah, that's a tough question. Mm-hmm. My recommendation in general, if you know that you have sensitive skin when you try a new product, or you turn red really easily, or you've had issues in the past with tolerating products on your skin, just go with the lowest, and then gradually you can go up. If you don't really know and you want to just give it a try, I might take flack for this, but I say go with the strong one. Go with the veteran, because you can make a strong one weaker, right? But you can't make a weaker one strong. So if you would take the veteran, you might even start, instead of just doing, like I said, every other night with the moisturizer sandwich, you could start by diluting it, 2 or 3 to 1 directly with moisturizing your face, then putting on the dilute version of the retinoid on your face, then moisturizing again. And then as you tolerate it better, you can increase the frequency, and then you go in every night, and then you can decrease the dilution. But it gives you a lot of versatility, and that I think is really important, because the most frustrating thing to me is when people aren't getting the results they want, and then I have to tell them, oh, well, now you got to order a new product. So I'd rather you have that tool, and then we can work together to make it the most effective and tolerable for you.
How can the anti-aging night cream be used with the spot cream?
They work perfectly, really well together, and I think I touched on this a little bit earlier. Musely does have the spot cream that's like the all-in-one, which sounds really good, and it is a great product for certain people for sure, and I prescribe it a lot. But my preference is to break those up, so you don't have the tretinoin and the hydroquinone combined. You get them in separate prescriptions. That way you can use the spot cream up to twice a day, and then you can still use the night cream once a day, and that way you can titrate the strength separately of the night cream, which is the one of the two prescriptions going to cause you more irritation. And the way that this works is that you just basically have 2 layers inside your sandwich. You've got the turkey, and then you got the cheese, right? And it doesn't matter the order. And, you know, some dermatologists say you need to wait between layering. There's not really good evidence. I think it's just kind of, again, an art. I say that you can just put it on, then put one cream on, and then the other one, and then the next one. And I've done this. It's not like I've only done this once or twice. You know, I've been doing this for over a decade. I treat maybe 100 patients a day. So I've gotten really good results. People are happy. So I know that it works well. So short answer, you're just adding that in there. Just keep in mind the anti-aging is only at night.
Okay, great. And if you are using both treatments, just to reiterate, does it matter which order you're using them in?
No, it doesn't matter the order.
Okay. So we're getting into our last few questions here.
That's so sad. And I really love everyone being here. And I got to say, it's nice when I see the hearts pop up. That makes me feel good. You don't have to do it just to make me feel good, but I did like it. So hopefully you have enjoyed it. That's the bottom line, and I gave you some useful information.
So what SPF number do you recommend for use with the anti-aging night cream?
Yeah, the American Academy of Dermatology has a standard recommendation, which is just 30 and above. That's a great question. I like to talk about this one a little bit. You know, at 30%, you're blocking like 98.5% of the harmful UV rays or UVA rays that are causing photoaging. And then if you go to 100, you're going from like 98.5 to like 99.6. So incrementally, it makes very little bit of difference. What matters is that you find one that you like that doesn't like, you know, leave white blotches on your skin. So if someone tries and uses the 100 and then they don't really like it and they just put a thin amount on, they don't apply it, that's no good. You're way better off using a 30 that you really like. The key thing that I really want to emphasize is you want a mineral-based sunscreen. Okay, so you should be able to easily pronounce and remember the names, basically, which is zinc oxide and titanium dioxide. Those are the 2 ingredients. And the reason why is the other chemical sunscreens work really well to prevent skin cancer, but they don't work as well to protect you from the signs of photoaging that come from the sun because they're not as broad of a spectrum. They don't do as good of a job blocking other wavelengths of light in the UV spectrum that lead to wrinkles and fine lines. And when you're treating your skin with tretinoin, you will become more sensitive to the sun. So it's going to be even more important that you wear a really adequate sunblock, a mineral sunblock, because otherwise your skin is going to be more sensitive. You're more likely to maybe burn. You're more likely to have tenderness or irritation. And if you're treating these dark spots and investing in your skin, you don't want to have the sun, because even short courses of intense light from the sun or heat can make it rapidly worse, and you can get set back, you know, a month of work by 20 minutes of being in the sun, unfortunately.
Yeah, it's so important every day. I know, because of my complexion.
Yeah.
Oh, well, does Musely have a sunscreen?
Musely does have a sunscreen. They have a white kind of finish sunscreen, and they have a tint. So if you have like a darker or olive skin type, you might like the tint more. If some people have lighter complexion like you, Chloe, they might like the whiter sunscreen. And it is a mineral sunscreen, so it's a great sunscreen if you're interested.
And we do have our clear sunscreen too, as well. That one's my favorite. So we just saw a comment about the anti-aging night cream set, including the day cream. It does. So we do offer bundles with the anti-aging night cream and the spot cream that include our gentle cleanser and the day cream, which is our SPF. And let's see, we do have a few more hair questions. So does the hair pill help hair follicles from closing up?
Yeah, absolutely. You know, the earlier that you intervene, the more likely you are to preserve those hair follicles and prevent them from closing up. That was my biggest mistake personally, is that I waited so long to treat my hair loss. So, you know, you're maxed out. Like over time, like I mentioned before, as those hair follicles close up, and it becomes what is considered a scarring process for the hair. I mean, you don't see it clinically a scar, but the hair follicle closes up, so we call it a scarring process. There's no way to reverse that, and you won't get hair growth. So if you prevent that, it's going to make a huge difference. If I had started with the hair repair and hair solution 10 years before and continued it now, I'd have way more hair. But I was able to preserve what I could, and I think I did a good job, so I'm happy. But I wish I had started it earlier for that exact reason.
Absolutely. Are there other things that our patients can do to help with hair growth?
Having a great diet, being healthy, avoiding, you know, being sick, being stressed. Those are the most important things. You know, making sure that you're getting regular checks from your doctor, but just taking really good care of your general health and well-being. Because as I mentioned before, the hair is low priority for your body. Your hair and nails, they're the first things that the body says, okay, don't worry about it. We're going to worry about other things. So if you stay healthy overall, you sleep well, you get exercise, you try and manage your stress, and you try and avoid any kind of major sicknesses or surgeries and do the best you can, then your hair will thank you.
Great. So here is our last question. Is there anything else people can do to help with anti-aging besides using the anti-aging night cream?
It's kind of the same comment, but I'll tell you this. Sun protection, the sun is the #1 cause of signs of aging. It is incredible how much of the aging process really comes from sun exposure. And the lighter the skin you are, the more susceptible you are to it. But there are some great photos you can kind of Google, dermatologist, twin studies. People who are exposed to sun more than others are going to age way more quickly. And if you look at an older person and like their backside that wasn't exposed to sun, and you compare it to like their legs or their arms, it's a world of difference. I do that all day as part of my job. So I think it's really underestimated. You just kind of assume, oh, you're going to get older, you're going to get wrinkles. Well, it's not really true. If you're really adamant and vigilant about sun protection, you can make a tremendous difference in the overall aging process.
So as a reminder, we only had a little bit of time to answer our questions about anti-aging and hair loss today. But if your question was not answered, then please feel free to message our Musely Instagram and I can help you. And you can always contact our support team via our website if you have specific questions about your treatments or how to order. Thank you so much to everyone for joining, and thank you so much, Dr. Kirsch, for answering all of these questions today.
Thank you all. It's really an honor, and thank you for all the love. I'm sending it right back to you. I really appreciate it. And we're here for you. I look forward to seeing you on the Musely platform and helping you get the skin that you want.
Thank you so much, Dr. Kirsch. Have a nice evening.